Hey everyone, welcome back to The Explainer. Today, we're diving into something deeply important, a journey so many people face, but one that honestly just doesn't get talked about with the clarity it deserves. We're talking about navigating life after liver cancer treatment. You know, the liver is actually the only organ in the human body that can fully regenerate itself. How incredible is that? It means this post-treatment phase is a massive, empowering opportunity to rebuild. So over the next few minutes, we're going to map out exactly how to regain control over your health and your life, using clear, grounded medical insights.
Okay, let's dive into this. Here is our 5-step roadmap for today. Number 1, post-treatment recovery essentials. Number 2, the importance of regular checkups. Number 3, facing recurrence with hope. Number 4, seeking mental health support. And number 5, preventing future liver cancer.
Step 1, post-treatment recovery essentials. So the period immediately following treatment, it's incredibly delicate. To get that liver function back on track, your body desperately needs the right building blocks. Slowly taking in solid nutrition orally is absolutely critical. You really want to focus on high-quality proteins, vitamins, and minerals. Why? Well, think of protein like the scaffolding your liver needs to actually repair its damaged cells. Your liver has just been through an absolute battle, right? Supplying it with nutrient-dense food is literally the very first step you can take to coax it back to health.
And this brilliantly illustrates a stark reality. While good nutrition definitely helps us achieve normal liver function, we absolutely cannot ignore the high reoccurrence risk that's inherently tied to liver cancer. Because of this high risk, absolute alcohol abstinence is required. I mean it, zero alcohol. Even if your liver function appears perfectly normal right now, drinking dangerously limits your future treatment options if the cancer ever decides to return. So stepping away from alcohol entirely, that's just a non-negotiable part of protecting your future.
Moving right along to step 2, the importance of regular checkups.
3 to 6. I want you to remember those numbers because that is the golden rule for your calendar right now. Patients absolutely must undergo rigorous medical checkups every 3 to 6 months. Listen, this isn't something you just schedule when you're feeling under the weather. It has to be a strict, ongoing routine. This kind of frequency ensures that if literally anything changes, your medical team is going to catch it the absolute second it happens. Now, these checkups are incredibly thorough. You'll be getting blood tests that track both your liver function and your tumor markers. Your doctors are also going to use advanced imaging, things like standard ultrasounds, contrast ultrasounds, CTs, and MRIs. And hey, please don't let the medical jargon intimidate you. The word contrast simply means they use a special dye that lights up your blood vessels, which lets the doctor see exactly what is happening inside. Think of these tests as your essential medical shield, keeping you one step ahead at all times.
Step 3, facing recurrence with hope.
Look, it's an undeniable medical fact that liver cancer has a high risk of returning. But acknowledging that risk does not mean we just surrender to it. Not at all. Because medical science has advanced so much, there are actually a ton of treatment options still available, even if the cancer comes back. So the crucial point is how you navigate this. You do it by following 2 non-negotiable steps. Step 1 is early detection, which, again, is exactly why those 3 to 6 month checkups are so vital. And step 2 is appropriate treatment. The massive takeaway here is to never, ever give up. If recurrence happens, you simply pivot and move to the next carefully planned strategy.
Which brings us to step 4, seeking mental health support. Up until now, we focused really heavily on the physical body. But let's be real, physical healing is only half the battle. Are you feeling overwhelmed by the journey ahead? If you're nodding your head yes right now, please know that you are not alone. It is completely 100% natural to feel a heavy sense of anxiety, fear, and just sheer overwhelm when you're navigating life post-cancer. Acknowledging that massive emotional toll, the lifestyle changes, the intense anxiety of waiting for checkup results, that's the very first step toward lightening the load. And you absolutely do not have to walk this path alone. There are entire structural support systems built exactly for this purpose. For instance, the Cancer Consultation Support Centers located at designated cancer care hospitals nationwide. These are vital, highly accessible resources, and they're meant not just for the patient, but for family members who are facing this anxiety too. Please, I highly encourage you to consult these centers. Protecting your mental well-being is just as absolutely critical to your overall recovery as tracking your physical health.
And finally, step 5, preventing future liver cancer.
Let's zoom out for a second to the bigger picture of long-term prevention. The fundamental truth about liver cancer is that preventing hepatitis viral infections is your absolute first line of defense. Hepatitis viruses are a major root cause of this cancer. Thankfully, medical science gives us an incredible tool here, the hepatitis B vaccine. It's readily available, and it's even administered as a routine vaccination for infants right from age 0. Preventing that initial infection literally stops the domino effect before it ever has a chance to begin.
Now, what's really interesting about this slide is just how much power you hold in your own hands. We're looking at some pretty dangerous risk factors here: overdrinking, obesity, diabetes, and smoking. These can lead to a fatty liver, which significantly spikes your cancer risk. But then, look at the defenses: a balanced diet, moderate exercise, putting down the cigarettes, and, if you haven't had cancer, practicing moderate drinking. These are everyday, highly actionable habits that directly combat those massive risks. You literally have the power to change the environment inside your body.
I want to leave you with this really powerful quote straight from our source material today. Knowing about cancer correctly protects you and your loved ones. It really is that simple and honestly, that profound. By absorbing the information in this explainer, understanding the need for nutrition, those strict checkup timelines, the reality of recurrence options, the mental health resources, and those preventative lifestyle shifts, you are arming yourself. You're becoming a fierce advocate for your own life and the lives of the people around you.
So I want to end with a challenge for you. Who will you share this vital roadmap with today to help protect their future? Information this critical just isn't meant to be kept to yourself. Whether it's a family member, a friend navigating their own health journey, or just someone who needs a little push toward healthier habits, take this knowledge and pass it on. Empower them, just as you've empowered yourself today. Keep learning, keep taking action, and we'll see you in the next explainer.